So I've worked in this community now for just over 10 years, and I don't know that I've been anywhere that I've seen as many babies and kids whose lives are impacted by drugs. Just a couple of weeks ago, I was working in the hospital, and in a single weekend, we had 5 babies whose mothers were using drugs. Some of them admitted to it, others denied that they could possibly have done this to their children.
I am Gus Nolte, Director of the Drug Abuse Prevention Center. The purpose of this video is to describe the efforts by the Drug Abuse Prevention Center to break the intergenerational cycle of babies being born with drugs in their system in Cowlitz County. We know that children exposed to alcohol and drugs in the womb can experience long-term health problems. Furthermore, mothers who abuse substances often have difficulties providing their children with a nurturing, safe home environment. These problems are costly to society and are completely preventable with the proper mix of prevention and treatment services. The board of the Drug Abuse Prevention Center decided it was time for us to design a program, a continuum of care, to provide services to these mothers. In November of 2003, we implemented our STARS program. That's an intensive outpatient program. STARS stands for Sharing, Teaching, Achieving, Recovering Sisterhood. That program provides enhanced outpatient treatment services for pregnant parenting women. The program is funded by TANF for those moms who have children, and for those moms who don't have custody of their children, we have a grant from the United Way. We found, after a couple of years of treating the women in intensive outpatient, that a more intensive treatment was needed. So in August of 2005, we opened our Pregnant Parenting Women Residential Treatment Center. The moms and children are taught a holistic lifestyle. The children spend their days in on-site and a licensed daycare center. In August of 2005, we also implemented our Parent-Child Assistance Program. This is an in-home intensive case management program for women, their target child, and a family for 3 years from time of enrollment into services. This program was developed and monitored by the University of Washington. The county also has a family dependency treatment court called Hope Court. That stands for Helping Our Parents Excel.
Most of those women suffer from a number of ailments: domestic violence, homelessness, and a big one is drug addiction. We have found that the success rates for women in crisis like that significantly improves with a stable residence, with some camaraderie, with some assistance in getting their day-to-day needs met and dealt with. We take women who are fairly dysfunctional, who don't have a job they go to every day, and we put them into a very complicated treatment, appointments, all kinds of things they've never done. And in the midst of all that, they have to juggle a child. A lot of these women have been so focused on just simply surviving that focusing on the needs of their child becomes secondary, which is really hard to believe, but it's the reality.
The Drug Abuse Prevention Center and the Longview Housing Authority collaborated on development of the Phoenix House. That's 5 4-bedroom, 4-bath dwelling units with integrated access to services throughout the community. Currently, we have 15 moms and 33 children in the program.
I was so lost and confused in my addiction that the best thing for me to do at the time was to call the police because I didn't have an answer for my problems that I had brought upon myself. And I was tired of putting my kids through it and putting myself through the agony and what was going on in my life. And CPS came and got my kids. So I left there with my duffel bag and started walking down the road. And I don't have any family or any friends at this point. So I had no idea where to go. I spent about a month on the streets trying to survive. There's got to be either make or break here. And I picked up the phone and I called the APC. And sure enough, that day they had a bed opening. And they asked when I could be there, and I said, I'll be there as soon as I can be there. And I was the most happiest, feeling free person on my way to treatment. I was just so excited to be safe and have people around me that weren't using and weren't abusive. And I was actually pregnant while I was in treatment. And so I gave birth to a clean and sober 9-pound boy. I got to keep him in my custody because he was clean and I was clean. I got my children back and we all got to move into the Phoenix house together.
The medical cost for a child born with drugs in their system, according to a recent Casey Foundation study, is $2.5 million per lifetime per individual. To date, 210 out of 229 babies born in our programs were drug-free, 92% drug-free rate. Savings of $525 million per the Casey Foundation.
6.5 years ago, I was on a 4-year everyday meth use stretch. I lost my home. My 11-year-old and 13-year-old daughter went to live with my mom, and I was separating from my husband and really basically was sleeping in my car. I had nothing left, which just gave me an excuse to increase my addiction, and that's how I was choosing to live the remainder of my life. At the recommendation of CPS, I was enrolled in Hope Court, enrolled in the STARS program through DAPC, and also the PCAP program through DAPC. I felt worthless, and I felt like I was getting out of life what I deserved, and I didn't understand why, but STARS helped me dig into the core of myself and discover that I was worth more than what I was giving myself. They helped me do amazing things. I got my driver's license back. I obtained employment. My son came home to live with me when he was 9.5 months old, and my daughters also came home, which is a miracle because the damage that I did to that relationship I really thought was irreversible. And I'm really close to receiving my bachelor's degree for human development.
The best thing that we can do for these babies is to get their moms off of drugs early enough in the pregnancy that they can develop and grow normally in utero and that they can be free of drugs at the time that they're born. And moms can't do this by themselves. They need to have trained professionals who can help them with it, and they need to have support groups of other moms who have been through this themselves. But there are programs that are excellent at doing this, that have good success rates. One of them in this community is our own DAPC program.
They may have had their children taken away the day before. They're a mess. They may be coming down from drug usage. And by finding a place for them to live where they don't have to worry about being abused, they don't have to worry about anything, you see them begin to blossom and they can start focusing on the other issues that they have and successfully overcoming.
And I'm the mom that I need to be. I'm the friend that I need to be. And I'm a grown-up now that takes care of things and just loves life and enjoys life the way that any normal person my age should.